explained to you, as a HR consultant, quite a few of my clients ask me some health and safety questions. So I'm really pleased that you've said that you'll answer a few questions so I can share some of that knowledge with my clients. So if you don't mind, I'm going to get straight to the point. In this very hot weather that we are having, and with the fears of the coronavirus outbreak, air conditioning units, is it okay to use them?
So that's an interesting question, because the Health and Safety Executive has just put out some guidance on this. And the answer is yes, it is safe to use them, but it's better if you turn the settings so that it brings in fresh air as opposed to using recycled air. There is some guidance on fans, using of Fanzos, and they actually recommend that you don't at this moment in time. And that's the short answer.
Okay, that's interesting. I think that's something people need to look up a bit further, maybe. So another one, coronavirus related. Is it really true that we can no longer make our colleagues cups of teas and coffee at work?
So this basically has to be risk assessed. And the safe answer is, if you bring in your own cup, you make your own tea and coffee, you use hand gel and you wash your hands on a regular basis, it should be fine. But there's no clear guidance on this one, and you've just got to decide yourself as to who's in there, who's at risk, and what the situation is. So I can't give any more than that.
Okay, well, that's good enough for me. So just on a more generic one then, on a kind of regular basis, I do hear my clients say to me, I'm not 5 employees yet, Sarah, so health and safety isn't, it doesn't exist to me. What's your view on this?
So it's actually a legal one for this one. So legislation says if you've got 5 or more employees, you must have written health and safety policies, written risk assessments, and everything documented. But what it doesn't say, but it does mean that if you've got less than 5 employees, you still have to do it. You just don't necessarily have to document it. So depending on what you were doing and what the level of risk is, I would definitely do it. I definitely have them in place. And I would definitely document them. Keep yourself safe, keep it all evidenced, but you do have to have them.
I know you've mentioned before as well, if you're a business that's planning on growing, then you've probably got the capacity to some extent to get it all in place. It'll be even harder once you've gone over that 5 employee point.
Well, if you've got it in place now and you know you're going to grow, so the policies and the risk assessments can be written with that in mind, so that when you do go over the 5 limit, it's not a panic. Oh, I've gone over 5, I need to have it documented. You've got it, and then you can just review it to make sure that it is suitable and sufficient.
Yeah, excellent. So staying on kind of policies and things, what's the difference between health and safety policies and a safe system of work? Because I've heard this safe system of work phrase, but I have to say I don't really know what it means compared to having policies in place.
So a policy basically says what your commitment is to your employees, to your customers, to your own businesses, to what you're going to do, health and safety related, how you're going to continually improve your health and safety. A safe system of work is more of a procedure or a method as to how you're going to do an individual task safely. So you would only use a safe system of work really for tasks that are relatively high risk. So you wouldn't use it for making a cup of tea. But if you're going to be using high risk equipment, you would possibly or probably put one in place. And then you would just bring it down to its individual steps and say what needs to be done at each step for that piece of that job to be done safely. So they're 2 very different things to do.
Okay, interesting. And then one of those little fluffy hillside animals, the furry little rams, I believe they're called, but I'm quite sure they've actually got nothing to do with the animals on the hillside. So tell me what rams are, please.
They've got nothing to do with those little fluffy animals on the hillside unless you work on a farm. So what it stands for, it's a mnemonic, is a risk assessment and method statement. And they go together very much hand in hand. So if you're going to do a risk assessment, and then you're going to do a method statement. It's very similar to a safe system of work. There's a slight difference between them, and very often contractors or people who are going in to do work, they will have to produce a risk assessment for the work they're doing and a method statement saying how they're going to do it, who's going to come in and do it, what training they've actually had to ensure that everybody remains safe.
Okay, makes sense again now then.
Yes.
Another thing I've heard a few times is, you know, people talking about a health and safety inspection and also a health and safety audit. Are they the same thing?
No, they're very different. So a health and safety audit audits a management system. All it's doing is it's checking to make sure that they have a management system that exists, it's adequate and is being used. And it will always use three methods of checking that. It will use inspection of documents, it will use an observation such as a walk around, and it will interview people that will ask questions. Whereas an inspection is designed to pick up any problems before they become major problems, and it won't use all three methods. It will use one, maybe two of them. So people are saying they're doing housekeeping audits. They're not. They're doing housekeeping inspections. They're going around to make sure there's nothing that anybody can slip, trip and fall over, or the fire equipment is in place and that everything is as it should be. Whereas a fire audit will check all the systems within that fire safety management system to make sure that, that there are drills being carried out, that the fire extinguishers are maintained by the correct people, that everybody knows what's to do, all the signage is in place, and that the risk assessment is there and it has been reviewed on a regular basis. So it's very different.
Okay, yeah, so got me educated a little bit more then. So another interesting one, especially times that we've had recently in 2020, health and safety training. What's your view on health and safety training being online, or does some of it need to be face-to-face?
So there's guidance on this as well about training, and it's quite broad, and it just says that the training needs to be suitable and sufficient, commensurate to the type of work that they are doing. So if you're in an office and you think, okay, we need some DSE training, do you need to go and spend thousands and thousands of pounds to get a consultant in to actually do it? You could actually just do some online training and make sure that people understand and actually do the DSE self-assessments as required. But if you've got, say, a factory working, and such as I've done some work in Burberry where they've got hundreds of people sitting at sewing machines, and then, yes, you definitely get a consultant in to assess to make sure that it is correct and that online training isn't suitable. If you're going on to do management training, depending where you're going to be working, it might not be suitable to do online training. You might need face-to-face. Each case needs to be decided on its own merit. And if you don't know which one you think you need, you can always give me a call and I will advise you. It won't cost you anything and point you in the right direction. At the end of the day, it's got to be cost effective against the risk.
Thank you, that's most useful. And then I've recently heard there's a few grants available for health and safety funding. Can you tell me any more about this?
Sure. So if you're based in the Leeds area, Sheffield area, or any of the surrounding areas, at the moment there are grants available, depending which area you're in, up to 50 to 60% for a health and safety project that will basically put everything into place that you need, all your policies, your risk assessments, your method statements, give you all the checklists that you need, and provide you with online training suitable and sufficient to what you need. And you will get 50% of it towards it. Now, the funding I have access to at the moment means that you only pay whatever percentage they decide. And it's a minimum of about 30, maximum of about 60%. You do not have to pay it all up front and claim it back. You only pay your bit, and you can pay it over 1, 2, 3 or 4 months. So
I think that's amazing. I think clients really need to get in touch and take benefit of that with you, Moira. So that's been fantastic this morning. Thank you for taking the time out to speak with me today, and I'm going to be sharing all those questions with my customers. Thanks very much.
And thank you very much for inviting me to actually answer all these questions. It's been a pleasure. Thank you.
Thanks, Moira.
Thank you.